Hello everyone, good morning and good afternoon for all the participants here. Thank you so much for supporting us and joining us today. Welcome to our CCT2 seminar. This session will be led by our moderator, Novitri Nurimani Asha. She is a psychology graduate from with a strong interest in mental health, qualitative research, and community-based psychosocial support. Her work has focused on engaging underserved population and promoting inclusive approach to the mental health care in Indonesia. In this event, she served as the moderator. So the time and screen is your Mbak Asya.
Yeah. Thank you so much, Mbak Hadi, for the warm introductions. Good afternoon to our participants in Indonesia, and good morning to those joining us from overseas. I'm Asya, and I'll be a moderator for today's sessions. Let me quickly outline today's agenda. Okay. Running from 9:30 to 11 a.m. Greenwich Mean Time, or from 3:30 to 5 p.m. Western Indonesia time. We begin the sessions with opening remarks by Prof. Santi, and then topic context, and then move to our main sessions is template analysis approach session by Dr. Jonah Brooks, and then we have 25 minutes Q&A and discussions, also 10 minutes for evaluation and closings. For disclaimer, these sessions will be recorded and may be shared with colleges or the public, such as on YouTube. If you prefer not to be recorded, please keep your camera and microphone off. Also note that your screen name might appear in the recording. So for attendance, please fill out the Google form we have provided and rename your username to your full name. Now, to kick things off, let's hear the opening remarks from Prof. Herni Susanti as a co-principal investigator of STAN and professor in mental health nursing at the Faculty of Nursing Universitas Indonesia. Prof. Herni, screen is yours.
Okay, thank you, Asya, for the welcoming. So, good morning and good afternoon. And also, of course, warm greetings for everyone who are joining us today. For those who are joining us, whether you are from the UK, whether you are from Indonesia or elsewhere, again, welcome. Assalamualaikum warahmatullahi wabarakatuh. Peace upon for everyone. It's a truly pleasure welcome for you to this online seminar. And this time, our topic is very interesting topic. It's about analyzing your qualitative data. And this is an introduction to the template analysis approach. We are very delighted to have participants from diverse backgrounds and location, reflecting that our shared commitment to advance the qualitative research in the global health. Thank you to all of you for taking the time to be here. We are especially honored to welcome to our speaker, Dr. Joe Brooks. Thank you, Joe, for giving or allocating your time here for about 2.5 hours. And it's still early in the morning in the UK now. I know it might be quite hard for UK fellow to start the day with the 2.5 hour. And we are very thankful for that. Yeah. And Dr. Joe will lead the two-day session and brings a wealth of expertise in qualitative methods. And we're very fortunate to learn directly from her, especially about template analysis, which is something for Indonesian researcher is we are looking for in research in qualitative, because mostly we are doing still very basic, ordinary, and then we will hear what is template analysis about. So the template analysis is particularly valuable in applied setting, and it's very ideal for exploring the social and health issues. And it also works well in collaborative, multilingual, and interdisciplinary contexts. So, like what we have been doing so far in our research. So, for this seminar, this is a part of the cross-cutting team within the STAN Indonesia Research Collaboration. This is a partnership between Indonesian and the UK fellows or researchers to focus on building sustainable mental health care system. As part of this work, we are committed not only to the clinical research, but also strengthening capacity across the teams, institutions, and communities. And for the information, Joe, and also we also have Rebecca here. Uh, we understand that the participants who already signed or joining are from many background and also from many provinces in Indonesia, from the Indonesian side. And they are from the academics and also from clinicians. So this is very a good moment to update our capacity in research. So once again, thank you for joining us. Yeah, this is one of the program for our STAN research. Yeah, so we look forward to learning together across countries and discipline, and then just wait for another program from STAN. We also have some programs waiting in the future. Enjoy the session. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon and good morning. Thank you.
Yeah. Waalaikumsalam warahmatullahi wabarakatuh. Okay. Okay. Thank you so much for the warm opening, Prof. Santi. Before we go into deep into today's topic, let me give a little bit of background about our topics today. This is the third seminar in our series on qualitative research hosted by STAN Indonesia. In our first session, we explored the challenges of conducting qualitative research in low resource settings like Pakistan and Indonesia. And in the second, we delved into practical use of framework analysis. So today's we're continuing the journey into template analysis. Template analysis is a method help us to organize and make sense of qualitative data in a structured and yet a flexible way. For those of you familiar with thematic analysis, template analysis is in the same family, specific approach within that family. Many of you might already know methods like Miles and Haberman's matrix analysis or the framework analysis we covered in our last series. But as we all know, analyzing qualitative data isn't simple as summarizing it. It requires a thoughtful approach that allow us to truly understand the context and nature to our data. That's why it's important to explore different methods and find the one that best fits to your data research need and maybe your big multidisciplinary team, whether you're studying patient experiences or workplace dynamics or educational outcomes. Template analysis could be a valuable tool. It helps you organize and manage large and complex qualitative data sets without undervalue the importance of meaningful statement at the sea of transcript, of course. Now we to help us explore the template analysis in depth, I'm excited to introduce our speaker today. Okay. Dr. Joe Brooks. Dr. Joe Brook is a senior lecturer at the University of Manchester's Manchester Center for Health Psychology in the UK. Dr. Brook specializes in qualitative research and qualitative evidence synthesis. She is a former chair of British Psychological Society's Qualitative Method section and currently chairs in the UK's Teaching Qualitative Psychology Group. With extensive experience in teaching and supervising qualitative research, but with students in healthcare settings, Dr. Brook is a true expert in the field. She is also a prolific author with numerous journal articles and 3 textbooks on qualitative research to her name. In 2015, paper on template analysis is one of the top 5 most cited papers in the journal Qualitative Research in Psychology. Today, she'll be sharing her insight on template analysis, and I know we are in for the treat. So without further ado, let's welcome Dr. Ju. Dr. Ju, the floor is yours.
Thank you so much. Are we able to get the slides up?
Yep, a bit.
Wonderful. Thank you so much.
Okay.
Wonderful. Good afternoon or good morning, everyone. So yes, today I'm going to be talking to you about template analysis, which is a particular form of thematic analysis. And something that might be useful to some of you when thinking about analysing your qualitative data. So could we move to the next slide, please? Thank you. So what I'm going to talk about today, we've got about 45 minutes, is first of all, we're going to talk about what is template analysis. Then I will quickly run through how do you do template analysis, and then using some examples from different research projects, we'll talk about when, why, and how you might use template analysis, particularly thinking about kind of health and social care type settings. Thank you. Next slide, please. So to start with, as in the introduction, my kind of expertise in qualitative research as a health psychologist, and the reason that I enjoy and think that qualitative research is valuable in these settings is because it's so helpful in helping us understand aspects of healthcare provision and services and what's really happening. So what's happening behind the numbers, in understanding things in depth, and when we lack understanding, so when there isn't constructs or theories or measures there which we can use kind of quantitative, larger scale quantitative work. The other reason why I think qualitative research it can be really valuable is the way that it is so well positioned to incorporate the views of those who the issue might be really affecting, so experts by experience and patient and public and stakeholder views. So it gives us a way to access their valuable knowledge and understanding, and also the methods that we can use in qualitative research can be accessible, inclusive, engaging, and empowering. But undertaking that qualitative research, as has been alluded to already, can produce this huge mass of qualitative data. So what do you do with that when you've got it? That's what we're going to be thinking about today. Next slide, please. So if we think about a really simple definition of qualitative research as it being about words rather than numbers, it covers this huge range of different data collection and analysis approaches. And what you want to know will determine the research approach that is right for your project, so what kind of data collection approach you choose, but also the analysis approach you select. And there are a wide variety available. Next slide, please. So today we're talking about template analysis, and template analysis is a set of procedures. It's a method which can guide you in the analysis of your qualitative data. It's a particular style of the broader thematic analysis family. And what all of those methods, thematic analysis methods, have in common is that they involve searching across a data set to find repeated patterns of meaning. So although you may have been speaking to lots of different people, this is less an approach which is about finding the individual meaning for people. It's about looking across all of those people. What are the patterns of meaning that emerge across what you're being told? As an approach, template analysis combines a structured analysis process, so it tells you what to do, which can be quite useful for people who may be faced with this massive data and who aren't sure what to do with it. So it can be a useful approach for beginners, but it combines that with flexibility. So as compared to something like framework analysis, which was covered in the last seminar, there is more flexibility within the approach. It isn't then a rigid prescription for how to do analysis. It is a series of steps which you can adapt to meet the needs of your particular project. And it also isn't a methodology. So it is distinct from approaches that you might have come across, such as grounded theory or something like interpretive phenomenological analysis. These approaches come with a particular philosophical underpinning to the research. So you have to approach analysis with a particular view on what the data represents and how you should be doing analysis. Template analysis is more flexible in common with lots of thematic analysis approaches, so that you can choose the position that you take. And what I'm going to do later on in this talk is describe 3 different projects which were undertaken from different positions to give you an idea of what that might mean in practice. Next slide, please. So because template analysis isn't attached to a specific methodology, it means it's theoretically flexible and it can be used to answer a range of different research questions. So let's take the example of you're investigating a particular, let's say, medically unexplained illness condition. You could undertake a piece of research from a quite kind of more positivist, quantitative, typical background. You might be looking for identifying facts. You might be interested in a research question like, what particular symptoms are associated with this illness condition? And that would be okay to do with a template analysis study. On the other hand, you might be more interested in understanding sense making in the context of that condition. And then you might be asking a research question more along the lines of, how do people who live with this condition experience it or make sense of it? Or you might be asking questions which explore the condition more in a kind of discursive way. For example, in what ways is this condition represented in media accounts? So all of these types of research question could be answered using template analysis. Next slide, please. So the onus then, or when you are undertaking a template analysis study, is on you to be clear about which position you are undertaking the research from, because that will inform the kind of analysis that you are undertaking. But whatever position you are taking, a template analysis study will typically involve the following stages. This is, of course, with the proviso that whenever we try to explain how to undertake a qualitative data analysis approach in a textbook or in a research paper, we do it in this very staged way. We say step 1 is this, step 2 is this, step 3 is this. And actually in practice, you will find that those steps blur to some extent. For instance, the first step in a template analysis study is to read through and familiarise yourself with the data set. So if you've undertaken the interviews already, you will have a level of familiarity. If you're transcribing them, that will certainly help familiarise yourself with the data. But you need to understand what the data is and have some sense of it before you start analysis. And then the next step is carrying out preliminary coding. So this is the same as other thematic analysis approaches, other qualitative approaches, where you are going through your data set and you are highlighting sections that might be relevant to your research, relevant to your research question, and assigning it a code. Sorry. Of course, though, in practice, it's impossible to read through the data set when you are undertaking this familiarization and not be already thinking, oh, that's relevant to my research. I would want to be coding that. So I think you need to be aware the whole time that these are the steps that we broadly recommend, but to also be clear that they will merge to some extent. So this carrying out the preliminary coding would usually, in template analysis, and this is one of the features of the method, would usually be on a subset of the data. So you wouldn't normally undertake coding on your full data set. You would start that out on a subset of the data. This allows you to work with much larger data sets and is really useful in applied settings, because if you are undertaking, say, 60 interviews, that takes time. If you wait until all 60 are completed, then you're likely not going to be hitting the timescales for the particular applied project that you have. So template analysis allows you to get started with analysis and be doing some of the data collection in conjunction with the data analysis. So that's one of the features of the approach, which we'll discuss as we go through. Template analysis may include some a priori themes, depending on the approach. This is another feature of template analysis, and it's something I'll discuss as we move through the talk. Then, once you have your preliminary coding, the next stage is to develop your initial template. Following that stage, you use this template to apply the template to the next set of data. And then the process in template analysis is that rather than carrying on the coding from the kind of very bottom up stage, you use this template to apply it to the further data and modify it where it doesn't fit. And this is an iterative process. So let's say in a study you have maybe 30 transcripts. You might form an initial template using a subset of 5 transcripts. You would then take that transcript and apply it to a following 5 set of transcripts, modify it as necessary, apply it to a further 5, etc., etc. So you carry on with this iterative process of developing a template until you have a final template which is used to support the interpretation of data overall. Next slide, please. Okay, a priori themes. This is a particular feature of template analysis. It is an option. Really importantly, it is not obligatory. But if it is helpful to the needs of your research project, it is possible to use a priori themes. A priori themes are themes that you have identified in advance of analysis as things that are likely to be helpful or relevant to the analysis of the data. So if, for instance, you have been asked to undertake an evaluation of a particular service and the funders want to know particular things about the service, maybe around kind of accessibility, maybe around particular aspects of who is delivering it, what's working and what's not, then you might have those as a priori themes to structure your analysis so that you know that you are providing the answers that are required. It might be that you are qualitatively investigating a particular theory as applied to a research setting, in which case it might be that facets of that particular theory might be useful to structure your analysis. However, one of the good things about qualitative analysis, as we've already seen, is that you can explore things in greater depth, that you can look at things might come up through qualitative analysis which you weren't expecting. So a priori theme should always be tentative. If, as you go through the process of analysis, the themes aren't working as they are, you can redefine them, you can combine different themes into a single theme, you can discard them. So you should only use them if they are proving useful to your analysis. And again, later on in this talk, I'll give you a specific example of how they can be used in a research project and why you might want to combine or redefine them. Next slide, please. Okay, so here is an example of a template. You don't need to know too much about the particular research project. It was around sort of models of clinical supervision within a healthcare setting. The purpose of this slide is just to show you how you can display your template when you have devised it. So this is an example of a template displayed in a linear format, and you can see it's numbered with different sub numberings under it. Next slide, please. And here is another way that you might be able to display exactly the same template, but this is in a mind map fashion. So you can see how things are linked and in a different way. Next slide, please. Okay, so the distinctive features of template analysis as opposed to other qualitative analysis approaches, and why you might want to use, why it might be helpful for a project. This process of developing and applying the initial template rather than preliminary coding of all cases. This can be really helpful in terms of speeding up the analysis process. And as I've already mentioned, it can be useful when you are overtaking a large research project over a set period of time. Additionally, template analysis, as compared to something like framework analysis, has a greater degree of flexibility. There is less requirements in terms of different levels of coding, number of levels, what the levels represent. There is a flexibility within template analysis for the research team to decide what works for their research project. So you are able to code at greater depth for those aspects of the template which are really relevant to your research question and what your research team needs to know. And there is this feature, as I've already described, of this cyclical nature of analysis. So the development of a preliminary template, which is then applied to another subset of data, which is then reworked, which is then applied to another subset of data. We've already discussed the use of a priori themes. Again, highlighting that those are optional. They don't have to be used if you're using template analysis, and there are no a priori themes that are helpful for your project. It is not a requirement to use them, but they are something which is often useful for people using template analysis. And then another feature of template analysis is this use of something that we call integrative themes. So integrative themes are themes that underpin many or often all of the other themes. So they are themes which it's necessary to understand the research in the context of that theme. And I think that that can be really important in kind of health and social care work, particularly because it might be that there is something about, for instance, a service which needs to be understood for all of the other findings to make sense. So I'm going to move on now to talking about some specific applied research examples, and the first one uses an integrative theme to illustrate this for you. So the first of the examples I'm going to talk about today was a piece of work that we undertook about 10 years ago now, and it was funded in the UK by a charity called Macmillan Cancer. And it was an evaluation of a specialist service which was novel in the UK at the time. It provided palliative and end-of-life care for patients in a home setting. So it meant that patients who lived in this particular geographical area and were able to access this service could receive treatments at home that they could in other places only receive in hospital. So it meant that they were able to stay at home and die at home if they wanted to, because they didn't have to go into hospital to receive these treatments. So it meant that this service was providing support in the community, including these complex interventions. And Macmillan were rolling this service out, and they asked us to undertake an evaluation of it. So we focused particularly on how the service worked, both how the people working for the service worked together as a team, how they worked with patients and carers, and also how they worked with other health and social care services within the geographical setting. So to do this, we interviewed 30 members of staff and volunteers from the service. We interviewed 21 current patients and carers, and we interviewed an additional 18 staff from services external to the service, but who worked with them to provide care to patients. Next slide, please. So we had a really specific focus, because that was what the funder had asked us to focus on collaborative working, so how services were working together, and on the experience of the service. So in terms of the a priori themes I was mentioning before, these can be seen as what we might term soft a priori themes. So we went in there knowing that we wanted to focus on collaborative working and service experience. So we did have those in mind as these are things that we are wanting to explore within the data. We were not just going in there at analysis thinking we're going to take a completely bottom-up approach and see what participants have to say. We had a specific focus on those elements, but we didn't define them any more than that. So they were soft a priori themes in that they were just kind of broad overarching themes that were guiding the data. So another feature of template analysis is the way in which it can facilitate team working, which can be really useful in applied healthcare research. So for this project, we had 4 members carried out initial preliminary coding, and then we kind of blanked out a full day in our diary and booked a room and got together in a room, and we met to compare and discuss our coding, to look at what we had coded and to group these codes into initial thematic clusters and develop our first version template. And we repeated this process, kind of blocking out days in our diary to sit and work together, and to develop the template and apply it to larger sets of data. Next slide, please. So this is a simplified version of the final study template. We've only put on here the very top and second level themes, but we had the 3 top level themes were: how does the service work with external services? How does the service work with patients and carers? And then future directions. And then we had an additional integrative theme, which was what makes this service special. So you can see that we've maintained those kind of soft a priori themes as our top level themes, but then we've provided answers to those underneath. So we have what were the policies, procedures, who does what, dealing with power and hierarchy. And then we additionally have this integrative theme around what makes the service special. And this integrative theme underpinned everything else that we had to say about the data, because it was recognised throughout by all participants that this was a unique service. They talked about things like there were the lack of hierarchy within the service, which they saw as absolutely unique within a healthcare intervention. You know, they described things like consultants coming to the house, and if the bedpan needed changing, the consultant would do that, and how that would never happen in other settings. And the fact that the service was successful, this integrative theme of these particular elements of it was felt to impact and influence everything else about the service. So we've got some kind of some illustrative quotes here from the different team members, and the research is written up elsewhere. There's references for all the research I'm talking about today, and which will be provided with the slides for this talk. Okay, could we move on to the next slide, please? Thank you. Okay, so next we'll think about a different research topic, and this one is type 2 diabetes. So bit of brief background beforehand. Type 2 diabetes, a really common long-term condition, and patient self-care is really important in the management of living with the condition. And there's been a considerable amount of research recently on the impact of low energy diets on type 2 diabetes. They've been shown to have some success in weight loss and even leading to remission. So low energy diets are very, very low calorie diets, and a continuous low energy diet is when a participant is consistently on this low energy diet, and that can be really challenging, maintaining that kind of diet consistently and continuously. So one alternative to this, which is also showing some success in terms of weight loss and remission of type 2 diabetes, is an intermittent low energy diet. And this is when a participant might be on, say, 4 days a week of a very low calorie diet, and then 3 days a week of more sort of standard, normal eating, for the want of a better word. So whether or not a healthcare intervention is acceptable to participants is, of course, hugely important, and one of the things that qualitative research is often really well positioned to go and explore, because it doesn't matter how brilliant your intervention is, if your participants aren't going to do it, it's not going to be very effective. So this particular example comes from an embedded qualitative study, which was part of a much larger trial looking at these different kinds of low-calorie diets, looking at how acceptable they were to participants. So I interviewed 10 people who'd taken the continuous low energy diet option and another 10 who'd taken the intermittent low energy diet option. And the focus was on how acceptable they had found the diets when they'd been on them for a while. Next slide, please. So because the focus in this particular study was on acceptability, we used much harder style a priori themes. So we made use of an existing theoretical framework to structure the analysis. Might you be able to just go on to the next slide for a minute and then we'll move back? Thank you. Okay, so this is the theoretical framework of acceptability. It's been used in different settings to explore how acceptable a healthcare intervention is to a participant. And it has these component constructs, which you can see down the left-hand side, which are effective attitude, burden, ethicality, intervention coherence, opportunity costs, perceived effectiveness, and self-efficacy. So I don't have time today to go into these in detail, but hopefully you can get an idea of this is a structured way to understand what it is about a particular intervention might be acceptable to a patient. Thank you. Could we move back to the last slide? Thank you. So we use template analysis in this study, as I say, using these a priori themes. So there's more of them and they are much more specific. So going into analysis, going into coding right from the beginning, we knew that we were looking for data coding it already thinking about those a priori themes. But because a priori themes are always used in this tentative way, we also made sure that while we were coding, we coded everything initially that we thought was relevant to the acceptability of the different interventions. We had those a priori codes in mind, but we would also have coded anything which didn't fit with those codes. So we wanted to make sure that we got the views of participants from both intervention types. And this is important in template analysis. When you are doing this initial structuring of the template, you need to take participant input from different kinds of participants if you have them. So we made sure that we didn't just formulate an initial template that was based on the continuous diet. We used a combination of transcripts from both of the intervention types to formulate the template. So we did 8 transcripts to start with, 4 from the continuous participants and 4 from the intermittent participants. And we structured the coding around a first version template around the constructs of the theoretical framework that we were using. However, as we applied the templates, it became clear that the theoretical framework as it stood didn't quite work for the way that people were talking, that we needed to adapt it somewhat. So we reworked the template so that it better captured what our participants were saying. Our focus in this research project was on looking at what was common and what was different around the 2 intervention types. So if you could flick forward now to not the next slide, but the slide after. Thank you. So you can see that from those all of those different constructs, the final top level themes that are in the published paper and in our final analysis, we cut them down to 4 in the end. So what was relevant to our research question and what was relevant to the participants was they want things around the prospective acceptability of the intervention. So before they even started the intervention, participants had quite strong views on whether or not it would be suitable for them. They had some fears around, whether they would be able to adhere to it. They had preferences around which one would be better for them. And of course, this was a randomized control trial, so there was no element of, they were just assigned to the interventions here. Whereas if we're thinking about rolling this out in applied settings, then it's possible that giving participants a choice of which diet and taking into account what their preferences might be really important. We combined the constructs of intervention coherence and perceived effort, because whether or not the intervention, the diet made sense to our participants reflected the effort they were prepared to put in to adhering to it. That was really important. If it didn't make sense to them, they weren't prepared to put the effort in to maintaining it. Opportunity costs was a really significant theme, but it was really talked about. If you think about our work was around diet and food, it was often in social terms, those opportunity costs. So it was about not being able to participate in family meals, not being able to enjoy social events in the same way, or conversely, improving family diets. It was very kind of interpersonal, that theme. It wasn't about opportunity costs for the individual. And then finally, self-efficacy. And there was lots in that theme about whether change was permanent or whether it was particularly in the context of an RCT, people struggling to think how they were going to manage without that level of input and support from the research team. So again, that paper is published, and you can have a read of it rather than the kind of whistle-stop tour I've given you here. But I hope that you can see that in terms of thinking about template analysis, it gives you an example of how you can move from those very kind of hard, fixed, useful theoretical a priori themes to moving to what might be useful to explain and represent your data at a later stage. Okay, next slide, please. Okay, so the final example I'm talking about today is from, again, a different kind of methodological, philosophical underpinning. It's from a more what we would class as a phenomenological perspective. So phenomenology is a completely not enough time to cover that today, although I'm sure that you could have a really interesting seminar on that in the future. But phenomenology is much more about kind of experience. And if we're thinking about the kind of different research approaches that we were discussing before, this might be considered to be more about an individual's experience of something rather than this kind of, what were the themes that came out across the data. So the example I'm using today is about a study which looked at simulation-based learning in medical education. And the background to the work is that empathic care, so healthcare professionals who provide care which shows an understanding and acknowledgement of the patient experience, is known to promote improved outcomes for patients. But we also know that medical students' levels of empathy declines as their study progresses. So we know empathy helps, but we also know that medical students become increasingly less empathic as they become more experienced and as their studies progress. So the team involved in this research developed a learning activity to develop medical students' understanding of the experience of having a melanoma. So it's a cancerous skin melanoma. And what they did is they had this lovely approach to the work where they got a temporary tattoo of something which was a melanoma, and the participants were asked to wear it on their skin for 24 hours, and it was a transfer of a melanoma which was taken from a patient who had been newly diagnosed with it, and the participants also listened to the patient's account of receiving their diagnosis, and then they were interviewed about their experience. Now, just to note as well, you can see that our participant numbers are going down as we go through these different examples. So this kind of much more experiential, in-depth approach, there's 10 students involved here. So that was the participant sample. Next slide, please. So as I've said, it was used, template analysis in this instance was used from a phenomenological stance. So what they wanted to do was they wanted to understand the individual experience, but also the bigger picture. And this kind of refers to the fact that they wanted to understand it in the context of, they knew that medical students became less empathic. So it is in the bigger context of the medical training that students were being provided with, and understanding that they were going through this training experience as they were taking part in this research as well. So there was no use of a priori themes in this study. The analysis focused specifically on the immediate experience of the participants. And they established quality in the study by looking at, rather than kind of looking at different, does that fit into this theory? Does that match? Does my coding match with those a priori themes? They took on multiple perspectives of different team members who had different experiences and compared and contrasted those as part of the analysis. And that included getting people's views on the developing template. What they did in this study as well, and it becomes more possible when you do have these smaller participant numbers. Of course, it's not going to be possible if you've got 60 people taking part, but they sent their interpretations. So once they'd undertaken the analysis, they sent the analysis to everyone who'd taken part in the study, all the participants, and got their feedback on whether or not they were accurately representing their experience. As is standard in qualitative research, they used verbatim quotes to support their interpretations. And one of the kind of things that they did really nicely, I think, in this paper as well, is that they made sure that, yes, it was about experience and it was about phenomenology, but they made really sure in their kind of discussion of the findings to highlight well, what does this mean in practice? What's the applied relevance of this? How could this be integrated into medical teaching? Next slide, please. So again, the paper is available for those of you who would like to get a deeper understanding of this paper. But these were the final themes presented by these authors. So there was melanoma simulation as opening up new experiences, drawing upon past experiences, a transformative introduction to patienthood, and doctors in the making, seeing cancer patients in a new light. Final slide, please. Okay, so in summary, what do I think might be the potential advantages of a template analysis approach? Well, a priori themes are often really useful in applied research specifically, and when you're wanting to incorporate theory. I think as well that they can be really useful because they make you as a researcher acknowledge your starting point, where you are coming from this in this data analysis. So rather than pretending that you don't have any kind of these are the things I am prioritizing within this analysis, they just make you be more open about that and recognize where you are starting from and what your focus is. The flexibility combined with the structure we've discussed and the notion that can facilitate team working. Template analysis, because of this kind of iterative process as well of applying different versions of the template, means that the approach is quite well set up to handle larger data sets than it might be feasible to handle with other forms of qualitative analysis. And finally, this iterative development of different versions of the template means that you have a nice tight audit trail of the analysis process, which can be used to demonstrate the quality of your research, but also helps if you are working with other people in a team to be able to go back and understand why did you develop that in that way? How did that develop in that way? And next slide, please. And for those of you who are engaging with open research and open data, it's a way of being able to engage with those practices, even if you aren't able to make your data set open, which you might not as a qualitative researcher. There might be privacy concerns, there might be a number of very good issues why you can't make your data set public. But what you might be able to do is make your analysis process public, and that can be really useful for people to understand how the analysis happened. So this is an example of it's what's called a data note, but it describes the analysis process in a study which used template analysis, and it describes, I think it's 20 files which are openly available, and they demonstrate the different versions of the template working all the way through the analysis process. So if you're looking for a worked example of how analysis is undertaken, then I'd refer you to this. Final slide. Oh, sorry, just one before. Okay, so things you need to be careful of when using template analysis. The lack of a fixed methodological position doesn't mean that there is no methodological position. What it means is that you as a researcher or a research team have to be clear about the position you are adopting when you are undertaking your research. A priori themes can be useful, but they are not useful if you are enforcing them in a way that doesn't work for the data. So it's really important to be clear that they are there to support you, to help you, to link your analysis to what you already know to be useful, but we'd caution against using them in too fixed or rigid a way. And then yes, template analysis is flexible. That can be really useful, but it does mean as well that there is this danger that people can get lost within it or overly complex. And I like to finish off, it's from another thematic analysis approach, Brown and Clark's thematic analysis approach, but one of my favourite quotes from them is this: knowing when to stop with analysis, knowing when it is useful enough. And the analogy that they use is like it's like rearranging the hundreds and thousands on top of a birthday cake. That there comes a point when you need to focus on what is useful for you, what is useful for your readers, what is useful for your research participants, and overly complex analysis won't help with that. Okay, so with the slides, which I hope you'll be able to get hold of, there's lots of references. There's some there about doing template analysis, and then on the following slides, there is specific references for each of the examples that I've used. Thank you very much.